Hi, everyone. I'm Madeline Heim, health and science reporter for the Post Crescent and USA Today Network Wisconsin. Thanks for joining me for this week's Newsmakers Coronavirus Edition. Today, I'm really excited to have as my guest Malia Jones, epidemiologist at UW-Madison, who you might know from a message that she sent about COVID-19 to her friends and family that ended up getting really widely shared and discussed. I was looking back at that today, and a lot has obviously changed since then. For one thing, we've just spent 2 months almost under a statewide stay-at-home order. But I think I can speak for many of my fellow reporters and also the general public that your expertise has been really helpful to get us to understand this very crazy moment in time. So today I wanted to talk with you about yet another way that you've been getting the expertise out there. It's a project called Dear Pandemic, which is 10 women with PhDs who call themselves the Nerdy Girls, which I love, who are sharing facts about COVID-19 for an audience of people who aren't top tier scientists. They're just like us. So first, just for some background, I'm wondering, how you connected with your fellow Nerdy Girls to form Dear Pandemic, and then why you decided to include only women.
Yeah, thanks for having me on the show. So I started, as you said, it's been 2 months, a little over 2 months since I wrote an email to my friends and family about what I saw unfolding at the very beginning of this pandemic in the United States. And that quickly blew up and got really widespread attention. And I was getting a ton of inquiries from not just my friends and family, but total strangers and people of all walks of life about the pandemic, and came to realize that there was a real need for some reliable, easy to consume, direct to public information about the pandemic. I think the news media, reporters were struggling to understand what was going on. Scientists who actually study pandemics and coronaviruses during normal times were very busy trying to respond. And so as someone who studies epidemic disease more generally, I was able to step in and kind of help do that translational piece. It pretty quickly became overwhelming for me. And so I reached out to a longtime collaborator of mine, Allison Buttenheim, who was at UCLA with me in grad school. And together we came up with this idea to launch a Facebook page, which we called Dear Pandemic. It actually started on Instagram, and then we kind of proliferated it across Facebook and Twitter as well. Allison and I have fairly similar backgrounds. We both study vaccine hesitancy and population sciences. And so we really wanted to broaden the expertise that was available through the Dear Pandemic site. And so we invited some other longtime collaborators and epidemiologists, and as well as a few clinical PhD trained clinical professionals to join us. So that's how it got started. And your other question was about the decision to only include women. Public health in general is actually a heavily female dominated field. And so, to be honest, I don't know that many male epidemiologists. I reached out to Allison first because she is a longtime collaborator of mine. And together we kind of came up with this idea. Someone referred to us as the Nerdy Girls when we first got started. And so that kind of helped nudge us in the direction of having it be only women. I think there's also a somewhat deeper reason for that, which is that in society, in Western society anyway, a lot of the work of communication falls to women. And so we're kind of positioned to be that person that people are reaching out to with questions in the first place.
Right. Yeah. And I definitely have more questions for you on that coming up. But before we get to that part of it, I just wanted to ask a little bit more about, what was the goal of the project, and, what specific audience are you all trying to reach, and, what makes you want to reach that particular audience?
So we were getting a lot of one-off questions from friends and family members and strangers who were, for the most part, well-educated, intelligent people who just don't normally study infectious disease and had questions. And we're having a hard time finding reliable sources of information in the kind of murky waters of the news media and scientific science news that was coming out early on. And so our goal was really just to provide a reliable, consistent scientific voice that was targeted at people who aren't scientists, who do other things for a living. The audience that we want to reach is, I would say it's anyone who is outside the scientific community or outside the infectious disease community who has questions about how to live in a pandemic world and how to understand these recommendations about social distancing, about the statewide shutdowns and reopening guidance and why those things are necessary. And so it's a pretty general audience, but primarily a non-scientific one.
Mm-hmm. Yeah, I mean, just, sifting through things myself in the last couple months while I've been working on things, and it's definitely a challenge to kind of bring language down and, to get something to a more explanatory light. And so I think it's definitely really appreciated for sure. But so, to get a little bit more into what you are posting about. So in the last week, you've made some posts about, kids in the coronavirus, whether the virus is mutating, plasma as a form of treatment, and one of my personal favorites, which was how to tell whether a news story is solid information or sensational, which I think is always a really important thing to talk about, especially now. But I'm wondering how you all decide what to post about.
So the 10 of us have a Slack channel that's sort of our back channel communications method, and we have a couple of channels in there where we post either questions that we've received, and those can be incoming questions from a variety of sources, friends, people who are posting questions directly to the Dear Pandemic page, as well as just things that we've seen kind of popping up in our own social media pages a lot, things that our friends and family are posting about. And so we have a few channels where we keep track of those inquiries. And in some cases, there's a conversation that happens about how to approach those and who wants to take them on, who would be best positioned among us. And then whoever is kind of on duty for that day will write up a post about either an article that's come out, a question that we've gotten, or some situation that we feel like needs to be addressed at the present.
Yeah, that definitely makes sense. And, to something going back to touching on, reaching that audience of just the general public, is that why you decided to, just have things on the social media platforms versus, making your own new website or something like that?
Yeah, I think that it started organically. None of us are communications experts, and we don't have a communications person as part of the team. And so it is just kind of what we came up with. But I do think, we're reaching a lot of people on Facebook, and that seems to be a good outlet for most of our audience. The Twitter feed and the Insta posts have a little bit of a different flavor, but they're also gaining quite a bit of traction. And so people are liking it. We're getting great questions. And I feel like it's to meet people where they are, if where they are is getting their information on social media, is working pretty well for us at this point. And really our goal is to take, we'll take, for example, some scientific news item and just kind of highlight what we think is important about it, what questions we still have about it, and give the too long didn't read highlights for people. So just to help them kind of digest the huge amount of information that we're all getting right now. And I admit, it's such a huge amount of information. I don't read all of the news media or even all of the Dear Pandemic posts. I'm really very grateful for the team of women who are helping contribute to this effort, because it's great to have them all on board and be able to trust them all to post within their own expertise.
Yeah, that is really cool. And I'd imagine that with, a variety of women having different areas of expertise, that really helps kind of get that goal accomplished. So that is awesome.
Yeah, it is awesome.
And then, yeah, that is really great. So obviously Dear Pandemic is a personal project, or it's not of your job that you get paid for. So I'm wondering how much time per week you are spending on it.
I personally so I will say my job as a scientist at the university is to do research, and I have a grant from NIAID to study how diseases spread in populations. And that grant is it was awarded to study mostly measles and pertussis, but the more general aims of the grant are relevant to COVID-19. I'm also situated in an applied research lab. And so part of our lab mission is to do outreach work. So to some extent, the work that I do for Dear Pandemic, I do feel like is part of my, it's not, nobody could have expected this to be part of my job in January, but I do feel like it is part of my job now. And in terms of how much time do I spend on it, we have a system where we take shifts. So each of us on the Dear Pandemic team will sign up for however many shifts we feel like we can tackle. It's usually 2 or 3 per week. And during that shift, we just field questions. We have to do quite a bit of hiding or removing trolley comments from the page, and then also posting new content. And a shift is 3 hours long. So if I take 1 shift a week, I might spend 2 hours doing Dear Pandemic work and then checking in on the Slack page.
Gotcha. Yeah. So then to sort of transition back to what you had mentioned before about, women in science often being placed in these communicator roles, that sort of gets to another really important topic that you've spoken a lot about also, which is, the weight that women in science and women in public health are bearing compared to their male counterparts, that I think has been a little bit exacerbated by the pandemic. And when we were emailing previously to set this up, I know you had said that, Dear Pandemic is part of the solution, and it's also part of the problem. And I wanted to ask you a little bit more about that, because I can certainly see how it's part of the solution, but why part of the problem also?
Well, so one of the things that we're seeing right now is that a couple of weeks ago, academic journal editors started making comments on Twitter in particular, that they were seeing even fewer than normal submissions from female scientists. And I think what that reflects is that many of us, including myself, are at home with our kids. Women are more likely to be single parents and also do more of the unpaid labor of their household and childcare labor of their household, even when they are partnered with a man. And so with our kids at home, our time is even more than usually limited to do academic work. And then for me personally, I'm also spending a lot of my time doing Dear Pandemic work, as well as other outreach and talking to the news media. So in this communicator role, rather than doing original research that is for peer-reviewed publication. And I think that, that's my personal experience, but we're also seeing that being reported by journal editors and these other reports about the gender imbalance in science. And then layered on top of that, I think it's interesting in public health in particular is a very female-dominated field. In my experience, most of my mentors have been women, and that is fairly unusual in the sciences. Even fields that are now reaching parity in terms of their graduate student population, many of the senior people are male. In public health, I think that conversion started earlier, and so many of the senior people are female. My dissertation team was 5 people, and 4 of them were women. And my PhD graduating cohort was, I think it was 11 women and 1 male student. So in spite of that, what I'm seeing is that a lot of the highest level national news outlets are getting quotes from senior male epidemiologists. And so I think women's scientific voices are being underrepresented in general in the public health discussion about the pandemic. So Dear Pandemic is in part, it's useful to address that because we're amplifying the voices of women, the 10 of us all being women and sort of supporting each other and sharing the workload. I also think it's part of the problem because we are spending our time doing public-facing communications rather than writing peer-reviewed journal articles, right? And our time is very limited. So it's a choice that we're making. I think it's really important work, and I think it's extremely valuable. And I do wish that it was a little more gender equitable.
Yeah, that's really interesting. Do you have any idea why that occurs, that the communication role, public-facing role falls more to women in public health? Is there a reason, or does it just always shake out that way for some reason?
Well, I think it's really, if I can put on my sociologist hat for a minute, I think that this is a more general pattern within our society that we see women as the communicators, and we also see scientific authority as being more the domain of men. And so when we look for someone in a really high position or really authoritative scientific position, what we're thinking of is generally a man. And when we're looking for an advice column or a specific situation, or we need to bother someone with something, with a question that we have, we're more comfortable taking that kind of query to a female. So I think it's a general social problem. Working within public health, I'm actually mostly protected from the issues of being a woman in science, because most of the people in public health are women, and the men who are in public health, I don't generally see a lot of discrimination from those men. There are women in other scientific fields who I know face this kind of discrimination tremendously all the time, and I'm grateful to have been mostly protected from that.
Yeah, definitely. And I did see, I've been watching, I think ever since you first tweeted that, have been paying attention to sourcing and articles. And I did read this article from the New York Times it was a great article, but I noticed that they quoted like 15 some epidemiologists and only 2 of them were women. So I'm wondering what the effect of that is, obviously not only on the women experts who are then not getting their voice out there, but also for the public as a whole, who is, not hearing that perspective.
Yeah, I do think public health in general is, we see less from public health during non-pandemic times than we see from, for example, medicine or other scientific fields, right? Public health is not a part of the scientific world that you hear a ton about, except during a pandemic. And I do wonder if we didn't have these gender inequalities in science, if we would have been more prepared, if we, given that public health is mostly a female field, and that we in general struggle to accept women as authoritative scientific voices. I sort of wonder about how much better prepared we would have been and how much faster our response could have been if these gender inequality in science issues didn't exist, and if public health was more widely accepted as an authoritative scientific voice.
Yeah, absolutely. And so obviously as a journalist, I like to ask about, who is responsible to fix this? And it sounds like it might be a lot of people. It's on journalists to make sure that we're reaching out to diverse sources. But, who in your mind is, whose job is it to look at these things and take them into consideration and try to make them better?
So whenever I think about whose job it is to fix this, I immediately go to policy. And I think one way that we can address the situation broadly is to make public health a higher priority in terms of planning and policy making. And looking forward as we recover from the pandemic, I think that states and local governments and the federal government as well will need to take into account a public health perspective to an extent that they haven't in the last several decades. And I think what that's going to have to mean is that there are women in scientific positions of authority. So I'm a hopeful person in general, and I hope that as we move forward, some of this will start to self-correct. I also think it's the responsibility of universities who are bringing in new cohorts of students to make sure that those cohorts are representative and include not only plenty of women, which in general public health does, but also plenty of other perspectives, people of color and people of different economic backgrounds. And I have seen a lot of progress on that front in terms of who is being trained in public health.
Yeah, well, I definitely hope things keep moving in the right direction then. And clearly there are definitely things to be worked on. But taking it as it is and looking back just at the pandemic, I think it's really, really cool. And I'm sure that a lot of people are really glad that it's around to kind of help us sort through all of the information that we are going through right now. So to close out, I'm just wondering, what is one tangible effect or one effect that you hope to see come out of your work with the Nerdy Girls?
So I think we're already reaching a lot of people. Each of the things that we post on there has, it increases each week, but it gets to a couple thousand people each time. And we know that each of those times that it's shared, it's viewed many, many more times. And what I hope is that we are amplifying a scientific message that can compete with the kind of, the scary and less scientifically grounded messaging about the pandemic that's out there. I've seen a number of calls in the last week or so directly to scientists to get into the communications game and start sending out scientific messages that are fact-based. And that's what Dear Pandemic's aim is, and that's what we've been doing since the middle of March. And so I hope that what we're trying to do, I hope that what we are able to do is fill that gap and get factual information into the hands of real people so that they are not left guessing about what's really going on. And part of that is also that in the cases, there are a lot of things that we don't know yet about COVID-19 and about the pandemic. And so part of our communications message is really about what is not known. And so, when we're not guessing about what we don't know, we're in a better position to make decisions as well. So that's also part of what I hope to achieve.
Yeah, absolutely. That is a great goal and a really great note to end on. So, Malia, thank you so much for joining us. We really appreciate your work, and thanks to everyone who's watching for tuning in. I will be back in 2 weeks on May 27th with more Newsmakers. But in the meantime, you can watch our Coronavirus 5 in 5, which is a 5-minute rundown of the day's top headlines, which happens every day at 3 p.m. But in the meantime, I hope you stay safe, stay healthy, hopefully you can get outside to enjoy the nice weather in a socially distanced way. But thank you so much for watching, and have a great rest of your day.